The TMDU Center for Infectious Disease Education and Analysis, or TCIDEA, at Tokyo Medical and Dental University was established in November 2023. The abbreviated name, IDEA, reflects our pursuit of knowledge and new ideas for understanding infectious diseases. The center consists of three divisions: the Division of Clinical Medicine, the Division of Social Medicine, and the Division of Basic Medicine. The center director is Yoshiaki, who oversees the Division of Clinical Medicine. The deputy directors are Tomoko Yazawa, who oversees the Division of Social Medicine, and Hiroaki Takeuchi, who oversees the Division of Basic Medicine. Under the leadership of President Tanaka, TMDU has been actively working to combat the COVID-19 pandemic from an early stage. In addition to treating critically ill patients at the university hospital, each block within the university has responded to the pandemic by making the most of their respective specialties and working together as a unified team. The university is proud of the role it played in the pandemic response. Various issues have been identified through the university's response to COVID-19. In terms of medical care, there is a lack of human resources to promote both infectious disease treatment and infection control. Also, at the very beginning of the pandemic, we were not fully prepared with an awareness of the coming crisis. In terms of research, it is undeniable that the lack of human resources and facilities to safely and efficiently handle pathogens delays the establishment of a research system in the initial phase. In terms of intelligence, it's important for academia to disseminate reliable information from a professional perspective. To address these issues, the university has established the following three departments: the Department of Infectious Diseases, led by Professor Yoshiaki in 2021, the Department of Infectious Disease Emergency Preparedness, led by Professor Tomoko Yazawa in 2022, and the Department of High-Risk Infectious Disease Control, led by Professor Hiroaki Takeuchi in 2023. TCIDEA will collaborate organically with each block within the university and with the hospital, with these three departments playing a central role. TCIDEA will then take the lead in promoting infection control measures throughout the university.
The Division of Basic Medicine aims to promote basic academic research for responding to possible pandemics of emerging and re-emerging infectious diseases, and for building an organization that is resilient to infectious diseases. Specifically, the division will conduct various activities, including the use of Biosafety Level 3 facilities to elucidate the infection mechanisms of high-risk pathogens and the development of pathogen handling system in an effective and multifaceted manner through organic collaboration with both internal and external partners. The division will also manage infectious disease research inside and outside the university by making maximum use of the BSL-3 facilities, and it will train specialists who are familiar with the handling of pathogen up to BSL-3.
The Division of Clinical Medicine is committed to improving the infectious disease treatment and infection control systems at the university hospital and to training clinical infectious disease specialists, including not only physicians but also pharmacists and laboratory technicians. The division also conducts educational programs to raise the level of infection prevention and control at other medical institutions. Research topics include hospital infections and antimicrobial resistance control. Focusing on epidemiological approaches, the division is engaged in collaborative research with experts both inside and outside the university to realize high-quality infectious disease treatment and infection prevention and control.
The Division of Social Medicine prepares for worst-case scenarios during normal times in order to minimize damage caused by emerging infectious diseases. Once an emergency is detected, we will strengthen information management and promptly put preparedness measures into action. in the event of an unforeseen situation, we will respond proactively based on scientific knowledge. The abilities required include infectious disease intelligence, leadership, and communication skills. Based on these abilities, we will contribute to society by developing human resources that can proactively respond in the event of emerging infectious diseases.
TCIDEA's vision is to contribute to infection control in Japan and around the world through the collaboration of the three divisions of clinical, basic, and social medicine, with the aim of realizing a society that is resilient against infectious diseases in the face of new threats. In normal times, the Center is committed to promoting infectious disease research, education, and treatment, and to collaborating with related organizations and domestic and international experts to promote infectious disease measures needed by society. Human resource development is among the most important tasks. In addition to training specialists, efforts should be made to raise the standard of infection control in a broad range of settings. During an emergency, we will build on our efforts in normal times to establish a system incorporating the concept of an incident command system, and we will promote initiatives that leverage internal and external collaboration. The challenge in implementing these measures will be how to make the switch to an emergency response quickly and smoothly. We hope to meet this challenge by enhancing our infectious disease intelligence, routinely collecting and analyzing information on infectious diseases and disseminating highly reliable information is useful for detecting new threats. In addition, by establishing a system for rapid and safe identification and analysis of pathogens, we aim to create a system that enables a smooth transition for an emergency response. Of course, these activities cannot be realized by our university alone. We will strive to promote broad and deep collaboration with government organizations, domestic and international research institutes, universities, and medical institutions, so that we can contribute to an emergency response. We'd like to ask your continued guidance and support. Thank you for watching.